So because of that, many, many years ago, I think in the 1970s or 80s, they realized that a really good surrogate marker for figuring out what's happening in the small intestine is the breath test, right? So what's a breath test? A breath test is you are basically doing some kind of fast or detoxification protocol where you're avoiding fiber. That's really what you're trying to avoid. The reason you're avoiding fiber is because you don't want to feed. You're trying to like quiet down and not feed the bacteria that's in the small intestine. And if you're diarrhea predominant, then you do this do this diet for 1 day. If you're constipation predominant, I have patients do it for 2 days. But that's kind of giving the microbiome a little bit of rest. Then you wake up after this 1 to 2 day, prep diet is what we call it. You wake up after this 1 to 2 day prep diet and you hang out for an hour and you let your GI tract kind of warm up. Then you take a breath sample. So, one, a breath sample is not a stool sample. It's like that a lot more. They're very tired of collecting their poop. Two, the breath sample is a baseline to know where you are after your fast. Then you take a substrate, and the substrate is a little bit negotiable. It's either glucose or lactulose. And we'll talk about why you choose one or the other in a second. But you take a substrate, and then with that substrate, you start a timer and you track the way that that substrate is working down your GI tract for the next just about 3 hours. That's really important because I just gave you digestive rest. And now I'm trying to see what is biting, what is basically fermenting and letting off gases. There's two gases we're looking at. We're looking at hydrogen and we're looking at methane. Hydrogen is made by bacteria. Methane is made by archaea or methanogens. And that is not a bacteria. So everybody remembers, obviously, high school biology when we learned about bacteria, viruses, fungi, and archaea. It's a whole different species and it has a whole different mechanism and it requires a whole different treatment, which is, I'm going to talk about the importance of testing mainly because you need a map